Here in Brown County. Today, Brown County Public Health unveiling a new interactive dashboard called eChip. Now, this is the next step in a program that was announced last year with the acronym CHIP, which means Community Health Improvement Plan. It's what they are calling a 3-year roadmap for improving the health and well-being of those here in Brown County. And joining us today to learn more after today's announcement is Andrea Crescent, Community Engagement Manager for Brown County Public Health. So if you look at this thing, it is very clear, Andrea, that there is a lot of time, effort, and certainly mass amounts of data that have gone into this. Everything from economic security, children lead poisoning cases, mental health, to safe walking paths. Ton of information. Who's using it?
Yeah, so that's a really great question. We really want this to be an accessible dashboard for our full community. And I think where folks want to get engaged can sort of determine where they dig deeper into that data. Because as you mentioned, there's so much there. But I think we did a really nice job of organizing it by priority area and then digging into those strategies that really feel the most relevant for different parts of our community.
All right, before we get into that, let's get to how did you accumulate all this data? You have a lot of partners in this, so how is all this data put into one database?
So every 3 years we do what's called a community health assessment, where we listen to our community members, we look at different national databases, state databases, and we try to sort of really understand what's going to be most relevant for our local community. And after a series of conversations and different surveys and everything, we decided to put it all together into a dashboard where we could make sense of all of the different points that we were sort of trying to highlight.
So who's making sense of it? Is this healthcare organizations? Is this nonprofits? Is it just John Q. Public out there who maybe thinks, I might want to live in Brown County, but I want to see X, Y, and Z, which you can see on this dashboard. Is it everybody?
So there is an organizing group called Beyond Health, and it's a community collaborative. It's leaders from the healthcare systems, it's leaders from local public health, it's nonprofit organizations that have a health focus. And so the steering committee, Beyond Health, takes up this role of sort of pulling all of that information together, advocating for these priorities, and really making sure that the resources are there in order to make it happen. And then we have organizations in our community who are our strategy leads. Those are the boots on the ground folks, the organizations, the nonprofits in our community who are doing that day-to-day work of advancing those priorities.
So have you seen any of those organizations take some of this data and actually do something with it? Do you have an example of that?
Yeah, definitely. So one example I can highlight is the University of Wisconsin Extension offices here in Brown County. They actually took some information that they had learned through a survey that they completed earlier this year, and then they turned some of that information into a map that talks about food access in our community. So how easily folks can access healthy foods that are culturally competent. And they're highlighting a lot of that work in this dashboard. And so they took real needs in our community. So maybe folks not having access to the food that they needed, they tried to first understand, and then they moved that into action. And now they're working on closing some of those gaps that were identified. So that's a real nice example of one area.
There are 3 goals that you guys established with when you put a CHIP into action. I'm going to read these for you. They are equitable access, social cohesion, and unified planning and policy. So that was when you announced CHIP. How does eChip move you closer to those?
So the eChip gives us an opportunity to develop those strategies underneath those priorities. So those 3 priorities that you mentioned are really like big sort of broad goals that we have for our community. But when you start with something so big, how do you sort of make it happen? And so those strategies each have an organization that's leading that work. They have some plans in place for how they can actually sort of move that into action. And then the important thing with this dashboard is they're going to check back and make sure that those numbers are moving in the right direction. So not just saying, well, it feels good to do this work, but actually, are we truly making a difference? And are we looking at those data points over time?
Okay, so that's what I was going to ask you is like, you have all this mass amount of data. How do you make it impact the individual life? And I think that's the key there, what you're talking about strategy. So you said every 3 years you're going to go back, look at these numbers. So what's next in this process to make sure those numbers are tracking the way these organizations want them once they address the issue?
Yeah, so every 3 years is when we do that big, broad assessment.
Right.
But we're actually going to be updating this dashboard in real time as things change. So if new partners are added to this work, if someone hears about this e-chip and says, "Hey, I'm really interested in this one particular issue," then we can add them in to the planning that we're doing, to the action work we're doing, and so we actually plan on updating this e-chip much more frequently than every 3 years. I would say at least you'll see some changes every few months.
All right, very easy to find through Brown County Public Health's
Correct.
website as well. Andrea, thanks so much.